My name is Heather Vitinki, and this is my philosophy on nursing and healthcare. Now, when you get a project like this, the first thing you think about is what exactly is nursing and what exactly is a philosophy? So to answer this question, I headed straight to the dictionary. Now, according to the dictionary, philosophy is the critical study of the basic principles and concepts of a particular branch of knowledge, especially with a view to improving or reconstituting them. Now, according to Virginia Henderson, the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Now, this is a lot of words, and I do not do well with wordy explanations. So I went back to my basics, which was the nursing philosophy paper I wrote in my ADN program. I had to reassess what I believed in, redevelop what my nursing and healthcare philosophy was, and then develop this presentation. So what exactly is my view? Nursing is caring for the sick and the helpless. It is the fact and the act of treating everyone with the same level of respect and providing them the dignity you would want someone to provide you with. Nursing is the sacrifice of the soul. It is the truth of who you are and the knowledge of caring for someone other than yourself. I believe that nursing is something that you have to feel with your heart. You are never truly a nurse unless you enjoy your job a little bit more than that paycheck. Now, everyone can have a different view on how nursing is done, but mine stems from the fact that basic humanity, where people care for other people, is something that everyone should embrace. Humanity is treating everyone with respect, including the mentally ill, the disabled, people with infectious diseases, drug addicts, and yes, even criminals. We may not agree with what these people have done in their lives, but who are we to judge? We do not know their story, nor the circumstances that led up to the decisions that they made in life. I find it that I cannot allow myself to be swayed by these emotions and affect the way that I care for my patients. Now, a few personal thoughts. When you're a nurse, you do not have a 12-hour job or an 8-hour job. Your job is 24 hours a day, 7 days a week. A nurse is a nurse at home, at work, and even among friends. When you are a part of an institution, it is your duty to do what is best for the organization without compromising patient care. Healthcare is not something that should be denied to anyone. It is a basic human right. However, that does not mean that the people receiving the care have the right to humiliate the individuals that spend their time and energy to care for them. Nursing relationships with their patients must be therapeutic, and it becomes therapeutic when a nurse does not impose personal beliefs on the patient. Patients are always encouraged to express their emotions that they fear and bottle up within themselves. And sometimes, just sometimes, what they really want for that nurse is to just shut up and listen. Eventually, a nurse will be able to get a patient to talk about the things that bother them, and that may be a source of comfort. When we care for a patient, we are not taking care of the disease. They are more than a room number with a condition. They are people who have emotions and needs, and they need to be looked at as a whole and not just a pathophysiology. My philosophy in nursing and my work ethics guide my practice. I can honestly say that without it, I would have nothing to guide it. I know my nursing philosophy has changed over time as evidence-based practice and technology have evolved, and it will continue to do so. However, I am positive that my philosophy will not cause me to lose touch with my values and beliefs, nor will it compromise the way that I care for my patients. Being a nurse is something that I always wanted to do, and being able to become one has been a worthwhile journey. All I can say is that we are nothing but a means to an end, and the end is the ultimate goal. In this case, that would be the care of our patients.